So the next procedure we're going to do is to the piriformis muscle. Piriformis muscle is a muscle which is in the middle of the buttock. It often gives rise to something called piriformis muscle syndrome. It's a muscle that lies on top of the sciatic nerve. Piriformis syndrome is associated with sciatica, which is pain radiating down the leg, but in the absence of lower back pain. Often patients will have some sort of pain or pressure in the middle of the buttock, and on palpation or examining the muscle, you'll often find a lot of local tenderness. One of the procedures that we do a lot of is to inject buttocks into the piriformis muscle, and that can be extremely effective in actually relaxing out the muscles of the fibers, of the piriformis muscle, relaxing it out and reducing the sciatica, reducing the local pain. In this particular case, this gentleman has previously had Botox injections. Unfortunately, those have not been successful, so we're going to move on to something slightly different. We're going to put a pulsed radiofrequency current through the muscle in order to try and modulate it and hopefully relax it a bit. And Ems, can you just put it on motor for me at 3? Is cool. So now we have a little needle in the middle of the piriformis muscle. As you can see, the end of the needle's twitching. There's a characteristic twitch of this particular muscle, and you can see it's going nicely there. I have the muscle under my 2 fingers. What we must make sure is that we're not anywhere near the sciatic nerve, and I'm just looking down the foot. So we can see the leg there. There's no twitching in the leg, so we're not anywhere near the sciatic nerve. But if we look here, you'll see that there's some local twitching in that piriformis muscle bang in the middle. Perfect. Okay, it's down to 0, please. Now we're just going to do the second one along, and that should be there, and just go up. Yep, and that's twitching nicely at a relatively low voltage. There's no twitch in the leg, so we are exactly in the right place. Now, normally at this point, I would be injecting Botox into the area, into the muscle, having identified it. But as we said, in this particular case, we're going to do some pulsed radiofrequency. Could you put that on? So this is, we have a look at the machine. This is 3 minutes of pulsed radiofrequency, which is a radiofrequency current. Yep, put that on, please. Yes, please. And you just see the twitching of the muscle there with the radiofrequency, so bang in the right place. And we're going to do these 2, and then we're going to do the ones laterally over here.